Here's some things to know before you get filler so that you can have the best possible outcomes. I'm Ginille, a cosmetic nurse practitioner since 2013. I went to Stanford, I went to Duke. I don't play around when it comes to your face. So first and foremost, when you do filler, you want to know you can bruise and swell. This means you need to pre-plan before your appointment. You want to make sure the timing is right. Give yourself 2 to 3 weeks before your appointment, and I want you to start taking arnica. Eat pineapple. Try to do this a couple weeks before your appointment leading up to the big day. Avoid blood thinners like aspirin, ibuprofen, fish oils, ginger, turmeric, garlic, cinnamon, and alcohol. Those things are going to make you more likely to bleed and bruise. So this is going to help you figure out the right day before you get your appointment. Then you need to know afterwards, when you finish filler, things look a little exaggerated. I would say about half the patients like things fresh off the needle right when it's the most swollen. Other people, the other half, thinks it looks exaggerated. They don't like it. They think it looks crazy. So I always say plan for the worst, expect to think it's going to look crazy, and then God willing, it's not that big of a deal to you. So you also want to make sure, this is why we want to plan and make sure you have nothing major going on in case you don't like the way the swelling looks after. If you had been taking your arnica, your pineapple, avoiding the blood thinners, avoiding the alcohol, it's going to help minimize that bruising and swelling. Okay, from there, it looks exaggerated for the first few days. Usually the second day is the worst of your swelling. I want you to sleep on your back a little bit more upright. That helps minimize bruising and swelling. If you are laying flat on your face, you're going to swell a lot more. Also, you can risk moving the product. So know when it comes to filler, this is a gel. We have different types of gels that we use in our offices depending on who we're treating, what areas of the face we're treating, what we're trying to accomplish. But these gels are malleable. You can mold them if you're putting pressure on it. So I tell patients, hands off, let it be. It's going to swell. Don't get so nervous about the swelling that you start touching your face or moving things around. You don't want that. So hands off. You're going to ice the first 48 hours on and off. That's going to help minimize your swelling. Keep taking your arnica and pineapple. And then I want you to avoid saunas, extreme exercise. Avoid saunas, extreme exercise, salty foods, spicy foods, anything that would naturally make you swell or bloat. Avoid that. Long flights is also going to prolong your swelling. So if you can ice, be chill for a few days, up to a couple of weeks, it's going to help minimize your healing time. And like I said, things will look a little exaggerated in the beginning. Some people like the swelling. If you like when it's swollen, plan to add more to those areas, but you need to wait 6 to 8 weeks for everything to completely settle. That's how long it takes for filler to completely integrate or mesh in with your tissues. By 2 to 3 weeks out from your injections, you'll have a pretty good idea of your result. However, you still may feel the product in the skin and you might feel a little sore. That is all normal. You don't need to mess with it. So these are things you got to keep in mind. When it comes to filler safety, what we want to be mindful of is that we don't block blood flow off. So we've got blood vessels, our entire face, our entire body. We never want to put too much filler into any area that it's blocking off blood flow. So as providers, what we're looking for and what we teach our patients is what we call capillary refill. That means, are the blood vessels able to reperfuse? Is blood able to move like normal wherever we injected and in the surrounding areas? So we're checking that before you leave. We show you what to look for. Other things you should not have. You shouldn't have extreme pain. You shouldn't have any vision issues. Your skin color shouldn't look pale. Any of those things would be signs that, hey, we could somehow be blocking blood flow off and we would need to dissolve or break down the filler. So those are the emergency signs. Very rare, but very real. And so we want to be mindful of this when we're looking to it. This is what we coach our patients on, educate our patients on. I've been doing this for the past 13 years. I've never had to dissolve anybody for any emergent reason, and neither has anybody in my entire office. Jossie Skin and Wellness, we've got 3 clinics. However, these are things that we're looking for and want to make sure we can take care of our patients. We also see patients from all over the world. Every single time I'm in clinic, I see somebody that has flown in from somewhere else. And so we say when we're doing these treatments, we want to make sure that you stay in town at least a day. You don't want to do your filler and then fly out that same day, because we could, if there was any emergency, we want to make sure that we can take care of you. So again, I'm Ginille, cosmetic nurse practitioner since 2013, here to help you out. We can go through any of your questions. I'll read through them. I love coming on live. I like to help educate. I like to go through all your questions, Botox, filler, skin treatments, natural filler. We can talk through everything. I haven't been on live in I feel like 5 to 7 days. It's been spring break for my kids, so I have been running around with them. Okay, let me go through here. And if you have them, throw them in here. Oh, Karina said, I like the fillers you put for me. I'm so happy to hear that from you. So if we didn't, which I know you, but when you do your filler, so know in the beginning it looks a little swollen, we'll let it settle, we'll reassess. 6 to 8 weeks later, we can do more if you want. And when we're doing our filler, something really important you have to keep in mind is we're not spot treating. So we're not just here to do smile lines. In our office, we are considering your full face from all the angles. We're looking at how light reflects off your face. How can we minimize shadows, still making sure it looks like you and not this augmented weird face? But we want to think about the aging face, what's happening beneath the skin, where fat pads are separating, where they're sinking, and how we inject is just going to look really natural and true to you. And we're going to take in a bunch of considerations when it comes to you. So what you do for work, what you do in life, and if you're getting ready for being on TV or a big event, birthdays, all these things are coming up. These are things that we ask about so we can really make sure that the treatments are going to be specific to you, tuned in for you. You have the right amount of downtime. So there's a lot of thought and consideration that comes in before we do your treatments. And so when it comes, a lot of people are like, what is facial balancing? We talk about that a lot here. Facial balancing, we're considering your full face from all the angles. How are your features playing in relation to one another? We don't want just really full cheeks, really full lips and nose, and then a really short chin. That can look unbalanced. Or, a lot of people just want big, big lips. If you have big lips and then these are downturned corners of the mouth, look like a saggy old lady with no chin, and the lips are projecting past the chin, it can look unbalanced. So we want to look at you again from all the angles. We talk through this with you. It's never our way or the highway, but we want you to understand, hey, how are you going to look the freshest? This is what we do. In our office, we focus on very natural looking aesthetics. Also taking into account whatever is going on lifestyle-wise. If you're changing weight, all of those things will play a factor in how we do your treatments and when we do certain things. But I'm so happy to see you, Karina, and I hope you're doing awesome. I can't wait for everything to settle. Okay, can you talk about Botox versus Dysport? So those are two different brands of Botox. And so there's different brands we have FDA approved in the United States. We've got Botox, Dysport, Xeomin, Jeuveau, Daxxify, Lady Bobo. We have different ones available to us. Think of this as brands like Pepsi and Coke. There are little differences between them. However, a lot of people will tell me, look, I can't really tell a difference between one versus the other. Sometimes they'll say, like, I have a coupon for this one, I can try that. Sometimes people can tell a difference. Sometimes people will say, hey, I like the feeling of Dysport, it seems to be a little bit stronger for me. It seems to last longer for me. Sometimes people, I'm in acting and they don't want to fully take away all their lines. They want a lighter hold, a lighter feel. And they might say, hey, Xeomin feels better to me. So I encourage you, try different ones, see if you have a preference, see if one lasts longer for you or gives you a better outcome that you're looking for. A lot of people are like, I can't tell the difference, but this is really important for you to figure out what you like. Okay, I'm going through and I'm trying to answer them all. Let me see. Okay, it says on the website, I saw the virtual consult option, but do you still do Botox and filler consults? Yes, I will tell you, I am seeing patients and doing consults every day. I can't get to every consult, so sometimes you will do them with one of our other providers. You guys, the team is excellent. I would never put you on to anybody that's not excellent because I don't have time for that. So you might see Samantha. She's one of our nurse practitioners in our Las Vegas office. I work alongside these girls, these providers, every single day. We have the same philosophy, the same approach to care. We like to do these consults before you come in to go through your questions, your goals, tips on what to expect, how to prep for treatments. So before you even come in, we already have a game plan established. They talk to you about your lifestyle and what's going on and all these different considerations. We build out a treatment plan before you come in so you can prep before that treatment. We make sure we know the timeline of what's going on for you, major events, again, so we can plan this the best. The patients that do the virtual consults, It's so great. They already know. They're like, hey, I did all the pre-care. I did all the post-care. The timing is right. They bruise less. Their healing is easier. We send pricing. We send financing. So we really want the people to know the info, and it's not this like, hey, we're not just trying to throw all this at you at once. It can be a little overwhelming sitting in the chair, and then people are like, oh my gosh, wait, I didn't know all these things that you were going to talk to me about. Oh, I wasn't prepared to do that. Oh, I didn't know it was going to cost this. And we're not here to make rush decisions. So I feel like a lot of times people are like, oh, I'm just here and you're in front of me, so I want to do it. I'm like, no. We don't want to operate like that. We want to make really informed and well thought out decisions when we're doing this. And so this is why we do the virtuals. So even if you see one of the other providers, sometimes I'm still the one doing the treatment, depending on what it is. I focus a lot on like full facial balancing, facial injections. Sometimes I will, even if you consult with me, I might refer you to another provider. I have Niani on our team. She's a Black derm nurse practitioner. So sometimes like, hey, this Niani is my girl for skin. Like this is going to be where she's going to shine, and she's going to even be better than me at that. Even though we collaborate and say a lot of the same things, we work together. Like our patients know our team. If you ever come into our office, you'll see like we're very familiar with everyone who's going in, what's going on. I review every chart that's coming in. I know what's going on with the patients. So it's really cool. The team is excellent. I had somebody recently do a consult with me, and she's been seeing my team for skin treatments. And then she wants to come to me because we're doing all these injections on her face. And she said, when I walk into your office, she's like, I really feel like the spirit of God in your office. And I was like, that's like what I want. I just want people, we're here to like serve. We're here to work with you. We have long time relationships with our patients. I've been treating some of the same people for the past 13 years, and we are clued into you. Like we make a space where you're going to feel safe, seen, heard, beautiful. It's not a rushed thing ever. We ask a lot of questions. We want to know what's going on with your life. It's so much more than just like, oh, here's your Botox pokes and see you never. And like, you don't know what's going on. No, we probably talk too much. If you guys listen to these live, you're probably like, girl, quit talking. And I've answered probably 2 questions so far because we're just real well thought out and well prepared with everything we do, and great collaboration on our team. Everybody on the team can treat all skin types, all skin tones. Throughout the day, I will treat every skin color, and I have men and women and all the things. Every day, I do every single service in our office, and I love it. And I feel the same is for our team. Like it's fun, it's amazing for us. But our patients are coming in and they're doing not just one thing. We're working on the skin health, we're working on hair health, we're working on injectables, we're working on natural filler. We do all the things all the time. So, and things will change. So you might see me one time and then you come back in 6 months or a year later and lifestyle has changed. Different things are going on. Maybe you've changed weight. All of that plays a role. So every single time you come into the office, it's a conversation. We don't just say, okay, we're going to poke and do the same thing. Like it's a lot of talking. Our patients know there's a lot that goes into it when we're doing this. Okay. Someone says, genuine question. I've noticed one of your eyes blinks a lot more than the other. I don't even know. Tell me which one it is. I'm not trying to do that. I haven't noticed it, but point it out. Is that due to Botox? No, I don't have any Botox in right now. I am still breastfeeding. Anybody here that knows me, I've been breastfeeding a long time and this baby needs to stop, but I don't have any Botox right now. So I have like full movement of all the areas. Okay, what's your approach to treating genetic under eye hollowness? So if you have volume loss, sunkenness, hollowness underneath the eye, whether it's genetic or whether it's from aging, weight changes, we're going to be trying to restore volume. And we can do that with either filler or PRF EZ Gel, the natural filler alternative. So regular filler, you're only a candidate. It's going to give you the instant effect, but you have to be a candidate if you don't get puffy around your eyes, you don't cry a lot, you don't have bad allergies. Anybody retaining a lot of water around their eyes is not a candidate for filler because filler binds water. So if you naturally say, oh, I wake up and I'm puffy. Oh, I cry all the time. I got bad allergies. Oh, I'm always puffy through here. I'm like, nope, don't ever do filler by your eyes. I promise you, if you do it, you're not going to like it. It's going to look bad and it's going to be a long, long problem. You got to take it down. You got to dissolve it. If you don't get puffy and you have that hollowness, that sunkenness, that's where we can use filler. It'll give you an instant effect. There's different types of filler we use on different people, depending on how deep the hollow is, how thick their skin is, how deep their bone is, like what we're trying to achieve. So we use different ones. We do under eyes over 2 sessions. Do some, let it settle, reassess 6 to 8 weeks later. We can add more if needed. If it's perfect, we're not trying to overfill. But the skin underneath the eyes is so thin. I'm like, I expect you to bruise. I expect you to swell. So I want that to settle and then come back and we can do more if needed. If it's perfect, leave it alone. The natural filler alternative, anybody can do this. Even if you are somebody that does tend to retain water around the eyes, you're not going to risk getting worse swelling with a natural filler. So that is PRF EZ Gel. What we do is a simple blood draw in the office from your arm. We spin it in the centrifuge. It separates out your platelet-rich fibrin, your platelet-rich plasma. That has your body's growth factors and stem cells. We take that, we heat it and cool it. It thickens into a gel, and then we can inject that anywhere into the face. People love doing it underneath the eyes. Wherever we inject it, your body will form new collagen over time. So this is not the instant effect the way traditional filler is. This one is going to get better over time. The younger and healthier you are, the better the outcome. So you got to think, because we're depending on your body to have a healthy environment to make collagen. So my patients in their 20s and 30s that are doing this, when it's like not so hollow, it's just very minimal, I feel like they have amazing outcomes. Now, if somebody's come to me and they change weight, they dropped 100 pounds, okay, they might have a lot more volume loss. It can take a lot longer to get to the result. Thanks so much for your love. To get to the result, and it might not lift the same way that filler can. So these are all considerations that we do and we talk through when we're doing it. I was doing virtual consults yesterday and I had one patient come on. She was young. Oh my gosh, beautiful, like 28 years old. I was like, girl, get off this call. You're freaking the most beautiful person I've seen. But she was like, overall, I'm doing all these things in my life. I'm doing the skincare. She was like using the retinoid, the sunscreen. She wanted to like start getting on skin treatments. She was like very ahead of the game in my eyes. And she's like, I just want to like keep looking like myself long term. For her, I was like, I don't think you need augmentation with filler and you're not having a bunch of volume loss because you're so young. If we do anything, I would do the natural filler in these areas where we're going to naturally lose volume. So I'm thinking underneath the eyes, smile lines, corners of the mouth. This is not a big plumper. This is an overall slower process, but it's going to make those lines and hollows not be so deep. So I was like, that was my recommendation for her. Now, the next patient I talked to, she was in her mid-50s and she had lost a bunch of weight and she was like, hey, I feel like my cheeks are down. She's like, do you think I should do the natural one or should I do the regular one? When we're going through it, I was like, are you prepping for something? She's like, oh yeah, my birthday's coming up. I'm trying to look fresh. I was like, okay, black woman, fuller, thicker cheeks. So I'm like, okay, I need something sturdy to be able to create that lift. I think the natural one is going to be a little too soft and it's also going to take a lot longer than her birthday is coming up in 3 months and she's trying to get ready for her birthday party. So I was like, okay, it can take up to 6 months for the full results of that. And because, you have more significant volume loss because you're just older and aging happens as we get older and she had lost weight, I was like, hey, I recommend the filler to give you the most instant lift and I have more structure with that product. So it varies from person to person. Now, I said to her, she's like, hey, do I have to do that? I'm like, you don't have to. You can totally do the natural one. You got to keep in mind expectations. It's going to take longer. It might not lift as much. She's like, actually, I want to see it. So let's just do the regular filler. But she might end up maintaining her results with the natural filler over time. And so I meant to show a picture of myself on here. I used to put up a picture of me showing me at 28. I'm now 38 years old. So I have 3 babies and I breastfeed. This baby I keep saying 2.5, but he's going to be 3 in June. So I'm like, it's not 2.5. I'm just embarrassed that I'm still breastfeeding this baby. Anyway, so when I breastfeed, I get pretty hollow through my under eyes, my temples, my cheeks, my smile lines, like all these normal areas. I have 3 kids. My oldest one is 11. I breastfed him for 2.5 years. My second one, I breastfed for 2 years. Every time with those 2, I get pretty gaunt looking from losing fat in my face. And so in the past, I've done filler to help restore that volume. This time around, I've been doing the natural filler because it's just made for me. So nothing else is mixed inside of it. It's just my body's growth factors and stem cells. So I've been putting that in all the spots that I normally will lose volume: under eyes, temples, smile lines, cheeks, all my chin, all the shadows, my whole face. I've been doing that the past couple of years. And I'm like, dang, this time I don't look so beat up. And that baby's eating his chicken strip and then taking a drink at night. I'm like, okay, I'm still feeding him. I'm probably the same weight, but I'm older this time. I'm like, I don't look so beat up because I've been doing the natural filler and I've been doing skin treatments. So it works, but it takes time. It was not instant. When I first did it, I was like, that was a waste. I don't see any change. Over time, I was like, dang, I don't look so haggard. So just know it gets better over time. That's something you got to keep in mind. Guys, I have answered 3 questions and it says there's 58 messages, so I'm going to keep going. Okay. How long does PRF last? So PRF EZ Gel, the natural one that we're just talking about, your body making new collagen over time. New collagen helps the skin look lifted, look youthful, plump. We start losing collagen in our mid-20s and we just keep declining. So once you get that new collagen formed, it can last for a couple of years. However, again, the healthier the patient, the better the outcome. So if you're not smoking and drinking and doing all that, like doing that, getting a lot of sun, eating a poor diet, all of that is the environment in the body that helps maintain collagen. So if people are like, hey, I'm doing red light therapy, I have a healthy diet, I don't smoke, I don't drink, I'm doing my skincare, I stay out of the sun, their results are going to last longer. So it's just something to keep in mind when you're considering all of these. You can't go right or wrong with them, but well, you can go wrong if you're not the right candidate for filler. If you have a lot of volume loss, it's not wrong with the natural filler, but it might not give you the result you're looking for. So these are all the things we talk through when we're trying to determine what is going to be right for you. And a lot of people will end up doing both. Some people start with the natural filler and they want to see how, jumpstart that collagen, see how much lift it gives them. If they feel like it's not enough, they will transition to filler if they feel like they want to or need to. Some people will start with filler and then they'll come back and they'll say in a year or two, instead of doing filler again, they just want to do the natural filler, PRF EZ Gel, to maintain the results. So a lot of people will do both. Some people will do both in the same session, not in the same area. Some people might be like, hey, I'm not a candidate for under eye filler because I get puffy, so we're going to do the natural one. But, through my smile lines, through my mid face where I don't get puffy, my lips, my chin, I want an instant result, so I'm going to do regular filler. So all of this is going to be customized to you, your face, your goals, like what's going on. These are all the things we're thinking about when we do it. And it's so specific to you. This is why we like to do the consult, the virtual one, so we can start talking through these things. But again, it's like every time you come in, we're still talking and we're still educating and we're still asking a lot of questions to make sure we're dialed in for you. Okay, I got another one. I answered 4 questions. All right. Sorry. Okay, can you get PRP with filler under the eyes? Yes, but not in the same day. So I did filler under my eyes when I had my oldest, so he's 11. So it was like 10 years ago that I did it. And then I've been doing the natural filler for maintenance. So you can do them. Some people will start with a natural one. And then if they feel like they want or need more lift than what the natural is giving them, they'll go to filler. But I have a lot of people that will just do natural filler and never go to filler. And they're like, hey, I don't want filler, or I'm not a candidate for it. Or I just feel better doing something from me. And they stick with it and they do their whole face with it. And when we're doing the whole face, sometimes we're just doing more of it. So instead of drawing 2 tubes of blood, we're going to draw 4. So we can really hit up all the areas. And they're like, this is what I'm going to do. They might need more sessions to get to their goals, but these are things that we talk through. You're going to do a minimum of 2 sessions, whatever area you're treating. If you have a lot of volume loss, if you're older, we're going to be like, hey, a minimum of 3 sessions in the same area. You do them about 1 month apart. Okay. It migrated. Let me see. Somebody saying that. I'm trying to read through this question. I'm worried about migration. I have filler in my lips and it definitely migrated. Okay, Candace. So when people talk about migration, here are thoughts going on in my head, and then you can give me feedback. These questions don't keep moving. So when people talk about migration, here's all the things I want you to take into mind. First and foremost, usually people are talking about their lips or their under eyes. And a lot of times I think what's happening is these areas are actually overfilled. So if I start getting the story from them, I'm like, okay, you're coming to me to dissolve something migrated. You went somewhere, tell me more about it. When I start getting the story, they'll tell me, well, I went somewhere, I did the filler, and then, 2 weeks later or 4 weeks later, a month later, I did more filler. I'm like, okay, that was doing too much too fast. They'll say, oh, and they talk to me about the product that they're using. I'm like, what product was it? I know some of these products bind water more than others. They all bind water, but some bind it more. So I'm like, that's not the right product that I would use because it's going to get puffy. So that's one thing. You want to wait at least 6 to 8 weeks before you add more filler to the same area. If you keep putting filler and you're only giving yourself 2 weeks, 4 weeks in between, and I've heard a lot of people that say this has happened to them. Oh, well, the doctor said I can come back in 2 weeks. I'm like, your swelling barely came down, and then you're adding more onto there. So now we have a false idea of what the healed result is, and then you're just stacking it on. So there's really like, you're just molding it. You're just putting too much in. So I think it's a speed thing. So wait 6 to 8 weeks before you're adding more to the area. Also understand there's limits with these fillers. So if somebody has really, really thin lips, when I want to go really, really big lips, it's like, you got to understand at a certain point, if you just keep adding and thinking that they're going to just keep your borders nice and shaped, it's not. Like, if there's no space here, it's going to be puffy above the border. So again, overfilled. Again, when it comes with doing it too fast or too much, and the product choice, I don't expect patients to always know that. I'm like, that's not really your lane, because, you know, if I walked into a car shop, if they're telling me different types of oil, I wouldn't know anything they're saying to me. So I don't expect you to know the product type. But what I do want you to do as a patient is you do your research on who you're allowing to touch your face. So make sure, one, that they're licensed. Two, do a consult. Ask all your questions. How do they look? Do they look overfilled and crazy and you don't like the way they look? Well, that's what they think is beautiful, and they might inject you to be the same. So that's one thing. Look at their patient before and afters, read their reviews, make sure they're treating patients that look like you. Do you like their work? That's a big, important thing. If you don't like it, don't go to them. So I think it's doing too much, doing it too quick, and then the wrong product choice, and then just not understanding there's limits with it. If we just keep trying to put it in here, or, you know, trying to chase every single little line underneath your eye, and you're trying to get that line away. And I'm like, dude, if I can get that line away, but it's going to look really puffed because you're going to have so much filler in your face. Like, we don't want that. We really want to make sure you look natural. Sometimes I tell people, I'm like, if you can't live with, like, I can get that line away, but it's going to risk looking weird, looking overfilled, looking dumb. So I'm like, don't do it. I'm like, live with that little line. It's going to look natural. It's going to look better than me making you look weird by trying to chase and get every little line off. So those are some things. Oh, one other thing when it comes to migration is don't touch it. Don't touch it. You know, it takes 6 to 8 weeks for the product to completely settle. So lips, especially, oh my goodness, these girls and boys around Valentine's Day, they're getting their lips done and they're popping and they're like, but I had to kiss my man. I'm like, you did your filler 2 weeks ago. And of course it's migrating. Like, it's a gel. You can move it. If you're touching it, you're going to move it. So we tell our patients, hands off, let it settle. It takes 6 to 8 weeks to fully settle. That first month, like, if you're messing with it, you're going to move it. I feel like I get on here and I start scrolling and I see people, I got my lips done, and they're doing all that. And I'm like, no, don't do that. You're moving. It's a gel. So you got to be mindful of that. So let me know, Candace, hopefully I can find your message if you respond to me there. And guys, anything I say, it's with love. Like, I'm never here to like put anybody down. I'm wanting to help you think these things through. And I really want you to be educated and informed on all of this stuff. So I do this. This is what I do. This is all I've done for the past 13 years. This is not a side thing. This is like what I do. And this was not the talent that I was looking to have. This is what God blessed me with. And I love it. I never get tired of it. I can do it all day and keep going. He just gave me 3 kids, so I have to kind of stop so I can like hang out with him, and my husband too. Okay. Let me see. Do you recommend EZ Gel over filler? So we talked a lot about the natural filler, EZ Gel versus regular filler. This is, like I said, we just got to consult and go through your goals, what's going on before I make that recommendation. I love them both. For myself, I think I'm going to keep going with the natural filler for as long as possible. There's no spot on my face where I feel like, dang, I got to like get in. I got to stop feeding this baby, even though I do have to stop feeding this baby. But I got to stop feeding him so I can go in and like fill this area because I'm feeling really self-conscious about something. I feel really happy with the natural one. And I also really like that it's from me. I love filler, guys. I'm not going to villainize filler. Like, I love it. I do it all day. I have it all over my face. I just haven't done it in close to 4 years in my face. But this is what I do day in and day out. Like, I understand these products. I understand the differences between them. I treat really diverse faces. So this is just what I do and I excel at, and I understand how to get excellent and natural looking results. So you have to think about it when you're choosing your provider. Just make sure you're seeing somebody that's going to be thoughtful and is going to be mindful of you and your face and your goals. Because it's important. It's your face. It's your face and how you're going to present to yourself and to the world. So, and not everybody is as thoughtful and careful and caring. So it's just something I say, be mindful of. Okay. I'm trying to scroll and find them. Sorry, guys. I've been talking so much. I feel like I'm out of breath. Can I exercise? I haven't done my workout for I took my babies on a Disney cruise this past weekend and they were so happy and I need to do my exercise. Okay, I think I got it. Can you elaborate on what Aerolase laser treats? Yes, so Aerolase laser, we have this in our offices. We love this. We do it every single day. Like I'm using that laser and blasting that laser all day long. So safe for all skin types, all skin tones. There's no downtime with it. There's over 36 FDA approved indications, FDA cleared indications with the Aerolase laser. So we can treat several things from acne. I think it's a standout for treating acne. Like I love it for acne, redness, hair removal, just helping the skin look like the complexion and the bounciness, the youthfulness of the skin is what I really like with Aerolase. It treats fine lines, pores, texture, dark spots, all kinds of stuff, psoriasis. Like we do so many different things with the laser and we can treat it all over the face, the neck, the chest, the body. We use it, we can stack it or combine it with other treatments like our BioRepill chemical peel, our hydrofacial, our skin pen microneedling. So majority of our patients are stacking treatments on the same day. They're doing 2 or 3 of those, either the laser, pill, microneedling, like they're stacking them on the same day. When we're stacking these treatments, we can work on different layers in the skin. We can work on different skin concerns all in one day. So we have a skin membership program. Our patients come in on a monthly basis. We take care of your skin. We're going to consult. We're going to assess your skin. We're going to talk through your goals. We're going to talk through all the things. You want downtime? You don't want downtime. You want a pill? You don't want a pill? Like we go through a bunch of questions to figure out what's right for you. Also making sure that you can do your part at home with the proper skincare, and just making sure you're following all the rules, the post-care, pre and post-care. Because if we do something, I tell people, I'm like, don't invest in this if you're not going to wear sunscreen, or if you're going to keep eating dairy and that makes you break out, or you're going to keep picking at your skin and that's causing dark spots. So we want to talk to you more than just blast the laser, even though I love to do the laser all day. Like we're talking through, hey, what is the root cause of your skin concern? How can we minimize that root cause? And what are we going to do? And so that's what we go through, and we're checking in on a monthly basis. But even in 1 month, I saw a lady today, she was 50. It was her second time seeing me, her second month of her thing. And I was like already like the clarity in her skin. I was like, dang, I can see this. Now she still had dark spots, but I could see the texture was smoother. Like the way light hit off her face was just brighter. These are subtle things. I was like, she's like, I could see it. She's like, I saw it immediately. She's like, I saw it in 1 week. It was glowing. Like I could see a big difference. So I'm like, this is just the beginning. Like give me 3 months, give me 6 months with your skin. I'm like, oh my gosh, it's going to be transformed. So our patients love the skin treatments. Everything we do, safe for all skin types, all skin tones. We can do something from no downtime at all to if you want to get more aggressive and have some downtime, some peeling, we can do that as well. We have amazing pre and post care, like recommendations on our skincare. So we have our Jossie skin line that we know how it works in all different skin types and tones, and how it pairs with treatments and how it performs even if you aren't getting treatments. I'm like, if you don't want to ever get treatments, I'm like, this line works so well. It's effective. So that's all we're doing. Okay, someone said, where is your office? So I've got 3 offices, Jossie Skin and Wellness. You can find us in Los Angeles and Las Vegas. In Los Angeles, we're in Torrance and Mar Vista. And then in Las Vegas, we're on the Summerlin side. I see patients out of all of them. Most of our providers will see them out of more than one clinic every day. I'm seeing patients all the time. And I go to Vegas just about every week, if not every week, like 3 times a month. But we have amazing providers. If I'm not there, the other providers, even when I am there, there's other providers working alongside me, seeing their own team of patients. Like we have just great patients and long-term relationships. So that's so nice. Let me see. Someone said, don't be nervous. You'll be mad at yourself. You waited so long after you do it. But I don't know what she's talking about. Oh, she said she's nervous about doing a virtual consult. I don't think to be nervous about a consult at all, but I'm not here to be like, yeah, do a consult. Like it's really for you to come and us to talk about your questions, your goals, tips on what to expect, how to prep for treatments. Like we go through everything. This is not like a sales pitch by any means. Like that's just never ever what we do. We're really here to educate, hear you out and talk about, okay, these are your concerns. Here's how we can approach them. If you want to do, like, if you feel like, oh yeah, that's what I want to do, this is what it is. Like, we'll send you a treatment plan. We write that up. You review it. We send you written information. We send you videos. A lot of people will do their consults just through here. They're like, I've been watching your lives. You can answer my questions before they even get on a virtual. And so they're already really well informed. I post these whole things. So if you want to like watch it again, you can watch them again on my other pages. It's not here to be like making a rush decision. It is here to help you make informed decisions, build out a treatment plan that's going to be right for you. It's going through all the things. I'm like, hit me with every question that you got. Like, I want you to give us all the questions. We want to hear from you. Our patients have a really active voice in their treatment plan. It is not you just sit there and we do what we want. I will say, some of my patients tell me, I don't care what you're saying to me, Ginille. Do what you think looks best. I trust you and go for it. I'm like, I know, but I want to explain to you what I'm doing and why. And they're like, girl, shut up. You are wasting your breath. But again, there's a lot of thought behind each and everything we do. It's specific to you. So our patients come in and they're clued in, they're dialed in, not rushed. Most of these people are like, I've been already watching for a long time and I know what's going on. They're coming in and like, they're telling me their treatment plan. I'm like, how do you know? They're like, I've been watching. So yeah, we can talk through any of these things anytime. Okay, I know it says, Candace, you should wait. Sorry. You should wait 4 hours. I know it says you should wait 4 hours after tox to lay down. Is that accurate? Yes. So after you do Botox, you want to stay upright for 4 hours, no saunas, no exercise, no hats that day. We don't want to press on any of the areas we injected. So when we're doing Botox, we're trying to weaken certain parts of certain muscles so that you don't make the expressions so hard and you can soften out the expression lines. When you do your Botox, it looks like little bee sting pokes. That lasts like 15 to 20 minutes. That'll go down, but we say, don't touch it. Just stay upright. You just go. You could bruise, not a huge risk, but it can happen. So just be mindful of that. If you have something special going on and you're like, there's no possible way I can bruise, make your appointment for a different time. After you do it, give it a few days. It'll start to kick in. Some people will tell me, oh, I notice it the next day. Other people will tell me it's in 4 days, 5 days, but it'll start to kick in. You'll notice that you can't make the lines so hard, or you try to frown. You're like, oh, I can't frown as hard as I normally do. It can take up to 2 weeks for the full effect. So after 2 weeks is when you know everything and we ask for your feedback. So you say, hey, let me know. Was it perfect? Cool. Where you're like, hey, I actually think we could have gone more in my frown, or we should have tried to lift my brows more. Again, we want to hear from you. We want to ask all the questions because we want to do the right thing that's going to be right for your face and what you like. In the beginning, you might not know what you like because you've never done it. And so I have a lot of people that'll tell me, I want natural, keep a little bit of lines. I don't want too much. And then after it kicks in, they're like, actually, I don't want these lines. Like, get rid of them. And it can change. It can change throughout your lifetime of doing any of the treatments. That's why we talk through everything every single time. Okay. Dee said, yay, it's time for, she probably, this is a long time ago. I'm scrolling back up to the questions. It's time for my Botox. How much per unit? So it is 15 per unit with me, and in our LA offices with our nurses, it's 13 per unit. In Vegas, Nevada, the law is you have to sell by a 50 unit vial or a 100 unit vial. Oh gosh, I think it's $650 for a 50 unit and $1,300 for a 100 unit vial. So that is our Botox pricing. How much Botox you do is really going to depend on your face, your goals, how strong your muscles are, how big the area is, what you want the outcome to be. So this is why we do the assessment. I can have somebody that tells me, I'm an actress, don't take my lines away or just soften them. I'm a therapist, I'm a teacher, I still want to, make some lines and show my excitement. Other people will say, freeze me up, I don't want to have any lines. So those are going to be two very different doses. If I have somebody with a big, big forehead and super strong lines, they're going to do more if they want to restrict them. If I have somebody, sometimes they come in and their forehead is like that big, I'm like, oh, you barely have any space there. They're going to do less. So again, really customized approach to you, your face, your goals, what's going on. Okay. I've tried Botox best between the 3 I've tried. Okay, so that's cool. I think we were talking earlier about different brands of Botox. Botox, Dysport, Xeomin, Jeuveau, Ledibobo, Daxxify. See which one you like out of all of them. Gosh, I like them all. I like Dysport when I do it. I feel like it lasts a little bit longer. I like to be pretty frozen up when I have it. So it's kind of annoying to see this, but it's fine. It's for the baby, the health of the baby. Okay, let me see if there's other ones. How long does dilute radius last? When do you start to notice the difference? So dilute radius is a collagen stimulator similar to Sculptra. I love Radius. Radius, I use that thing all day, and I use it in different forms. So regular Radius, calcium-based filler, it mimics bone. It has the most structure out of any of the products that we have available to us in the United States, FDA approved. I love it like in cheeks. I love it in chins, jawlines, especially for people that have fuller, thicker skin. It has the most structure, regular Radius. So I love that one. Now, when she's saying dilute, what we're doing is we're thinning it out. We take saline, lidocaine, basically like salt water, and we make it not so structured, not so thick. When we're thinning it out, we can do it in, smile lines, cheeks. You can kind of put it full face, just not underneath the eyes, into the lips. I don't put it into the nose. Wherever we inject it, it's going to make new collagen. So it acts as a collagen stimulator. New collagen can take up to 6 months for the full effects, but some people will notice it even within like a month that they start seeing improvement. But just know it can continue to improve. How long it lasts, so this goes back to how healthy the patient is. I say up to a couple of years, but the healthier the patient, the better they maintain the collagen, avoiding the sun and using their sunscreen, using their retinoids, having a healthy diet, not smoking, not drinking, sleeping on their back. All of those things are going to help maintain collagen and the results longer. So those are things to keep in mind when you're doing collagen stimulators. I love this product. I was seeing a patient today, a guy today, and he said, I've done regular Radius on him. I've done dilute Radius on him. He had done hyaluronic acid filler at another clinic before, and he was like, you converted me. I will never, ever do that again. He was like, they were doing some training and they did it free on me. He was like, it didn't even do anything. I didn't see the lift with it. And I'm like, I know. I'm not dissing hyaluronic acid fillers. I love those too, but I got to use the right product and the right patient, and every face is different. The amount of fullness and fat and thickness in the face is going to determine which product I'm going to use, and which we're trying to accomplish will also determine what product. So I love that. I've been using that one. That was the first product I injected, and I love it in my own face. So when I have it. Okay. She said, Joy says she loves it too. Joy and P says she loves it too. I know, I think it's an amazing product. And yeah, I've done regular Radius, my cheeks, my chin, my lower face. Thing to know when you're doing regular Radius is that it does swell more than hyaluronic acid fillers. So again, I haven't had filler in close to 4 years because I'm breastfeeding this baby. I've been doing the natural filler. But when I last did the Radius in my cheeks and my chin, it looked like Maleficent. Like my cheeks were so big. My chin was so much. My husband was like, you look like Jay Leno. Quit touching your face. This looks crazy. Like it looks a little extra for like a week to a week and a half. After a week and a half, I'm like, I wasn't even that mad at it when it was a little extra. He was just being ridiculous, but you can noticeably see swelling more so with this than I think the hyaluronic acid fillers. After a week and a half, he left me alone, and I was like, okay, I felt like it just looked natural. It looked great. It didn't look out of place. But just getting through that swelling time and knowing, it looks a little exaggerated in the beginning. When I've done the softer fillers, hyaluronic acid fillers in my face, like in my chin, he won't know. My husband won't notice when I do it. And then once it settles in a couple weeks, I'm like, I also don't notice. It's like a little too soft for me. So it just depends on the person. Not to say I use hyaluronic acids in my practice every single day. I got to use the right product in the right patient in the right part of their face, depending on what they're trying to achieve. So I love them all. I use different ones depending on the goals. Okay. I think I got them. Let me make sure. She said, love it. I know, it's such a great product. I'm so happy that you like it. Can you get lumps if you get natural filler? I've never seen anybody have any lasting lumps. Like right when we finish, you might feel them or see them. They settle. Like with the natural filler, PRF EZ Gel, very like every single time these patients tell me, like 3 to 5 days, it's exaggerated on the swelling, and then it settles where they're like, yeah, it was chill. It's not this like, oh, it's swelling up and down. Oh, there's bumps that haven't resolved. This is all made from you. I've never, no, I had an allergic reaction. Nothing like that at all. It settles really nice. We do this. Oh my gosh, I'm doing this all day with the skin treatments because patients really like it and never have anybody with any issues with it. On my own self. I did it probably 2 or 3 weeks ago. It looked a little crazy. Like my under eye, I had no smile. It was just so like blown out these first few days. I was like, this looks insane. Like people probably think I went filler crazy and overfilled my face. But also I didn't like follow the pre and post care. I just randomly did it one day. I didn't prep. I didn't do all the things. So if you prep, it won't be that bad. But even without prepping, it was like a few days. And then I was like, this is not a big deal. So yeah. Okay, which do you think is better? Filler for the face or, oh, sorry. Jesus, I love you. I love hearing that. I'm so happy to hear that. Okay, that's the name. Which do you think is better? Filler for the face or drawing the blood to put it in your face? This is what we were talking through earlier. So it depends on the patient, depends on their goals, depends on how old they are, depends on how quick they want to see the results, depends on how healthy they are, depends on how much volume loss is in the face. Those are all considerations. How much lift I'm trying to get. If I'm trying to get a lot of lift, a lot of structure, I'm probably going to go with filler. If they are younger, they don't need a lot going on. They're, trying to be more preventative. I'm probably going to go with a natural filler. If they have a lot of volume loss, I lost 100 pounds in my face. I want to see this. I'm feeling really self-conscious about my face. I don't like the way I look. I'm not happy with it. I might go with filler just to get a quicker result. So these are all the things. This is why we got to talk through you, your goals, what's going on, your lifestyle. And this is why then we can determine what's going to be best. And some people are going to do both. So yeah, this is why we will consult. We'll go through everything. Okay, Candace, she said, I wish I could send pictures because I have about 1.5, I think you're saying milliliters, and started with no top lip over 3 treatments. So Candace, tell me, you can send me a picture. Sometimes I don't get them on here, but tell me how far apart did you do them, and then what product it was, and then I want to see your pictures. Again, if it's a really, really thin lip and you're trying to go really full, I'm like, you gotta tread lightly. I would tell people, I'm like, you don't want to overdo because it's not great if it's all of a sudden it's just puffy up here. That's probably not what you were trying to achieve. So it's just something to keep in mind. Okay, I think I got them. And then it says, is PRP a natural filler used for dark circles? Yes. Let me explain this. So it's not going to change the color of your skin. So, if I put makeup on, if I decide to do it, I'll put concealer here because naturally my under eye skin is darker than my cheeks, the rest of my face. Somebody that's a little bit more fair, somebody white, and I can just sometimes see their blood vessels through. So I can't take away the blood vessels. I can't actually change the color of their skin. However, if it's hollow underneath the area, when we put the natural filler or PRP, and it's going to help make new collagen, it's going to help give a little bit of lift to that area, then it can look brighter on the face because it's not sunk in. So yes, we can do that for under eyes. People will tell me all the time, they're like, oh my gosh, you said it wasn't going to make it look brighter. You said it was going to change the color, but it looks better. And I'm like, it looks better because it's lifted, but it's not actually changing the color of the skin or taking away your blood vessels. So that's something to keep in mind with it. Okay. Let me see. We talked about, did I get them all, guys? Maybe I did. Where did it migrate? Oh, Sam, she was talking about lip filler. Okay, so yeah, you can send me pictures. I want to see. Okay, if you have other questions, you can always call or text the team. So that's the fastest way to get the answer. The number at the top of my page, 424-218-4023. That is our line to our office. It's a HIPAA compliant line. Your information is not going anywhere. I see every message that goes through. I have team members that I have worked alongside for several years that have been in the clinic with me, that hear me talk all day and see all the things we deal with the patients that are helping to answer those questions. But I see everything. If there's anything I don't know, or what do you think about this? They send it to me. We can do a consult. We can set those up virtually. You can do that at the top of my page. That's where we can go one-on-one and talk through everything. You might see me. You might see Samantha. You guys don't you guys don't have to see me. I promise you. Samantha's excellent. She's probably dang talks more than me, and she's so dang thorough, and everybody loves her. I've had people be like, oh, I wanted to see Ginille, but after I consulted with Samantha, I'm going to change my flight and go to Vegas instead. She is amazing, and you will love her. But sometimes Samantha will do the consults, and I will still see that patient. So she's going to help develop the treatment plan. I'm telling you, this girl and I are very aligned. And my team, we're aligned just because we all have the same philosophy and approach to treating patients. Everybody's been working alongside me. I'm doing things that I know have worked for years. I don't want problems. So I'm like, guys, let's follow what has worked. Let's assess the faces. This is how we approach the care. We talk, we go through, we build out a treatment plan. So we're all saying the same things if you come into our office. But yeah, set up your consult. You will love the team. And you can also do in-person consults as well. But I'm telling you, it's just those patients, they tend to be like, oh, but I didn't know. I forgot to read the notes. I didn't know I can bruise. I don't want to do it today. Oh, I forgot my friend's wedding is coming up. So then it's kind of they're not set. They're not like ready for it. And it just kind of prolongs their thing. In-person consults are $350. It goes towards your treatment that day. And I don't want people just be like, oh, I just want to do it to like use my money. I'm like, no. We want to be like well thought out. I do have some people that are just like, hey, usually somebody a little bit older, they're like, I don't know how to get on this virtual, or they're just like, look, I know I'm going to come and do this. I've been watching you. I've been talking to you online. I want to do X, Y, and Z. They're very well versed in it. Sometimes they'll come in and do it in person with me because they already know, and like we're doing multiple things that day. And they'll usually probably send me pictures beforehand and like send the team. Like we still try to coach them before they just come in and don't know anything about it. Okay, so you can set up those times to consult. If you have any other questions, I'm here for you. I appreciate you for joining. I will post this whole thing up. So if you want to watch it, you can check it on my other channel. I hope you guys have a great day. God bless you. And